Hopefully you were able to enjoy the recent cooler weather because, as Brandon has been telling us, the extreme heat is on the way if it's not already here. The increase in temperature also increases the chances of heat strokes, heat exhaustion, and hyperthermia. 23 ABC's Ruby Rivera spoke with local officials to discuss the differences between these heat issues and how to take care of each symptom properly.
According to the Center for Disease Control and Prevention, 618 people die each year from heat-related issues in the United States. Issues such as heat exhaustion and heat stroke are preventable, but only with the proper care. And educating yourself on the proper solutions for certain issues could mean the difference between life and death.
If somebody's lost consciousness or they're not protecting their airway, and you're trying to get them to drink water, they could easily choke on the water. They could, not be able to swallow it correctly. The key really there is to contact medical care. So call 911, get the ambulance out there.
Family medicine physician at Kaiser Permanente, Dr. Pooja Visalani, says when it comes to heat-related illnesses, prevention is always key.
Heat stroke can happen in a couple minutes, a couple minutes to a couple hours, but we won't know until it happens. So really, prevention is key for that.
Although heat stroke and heat exhaustion sound fairly similar, the CDC says they have different sets of symptoms and solutions. An increase in core body temperature, headaches, dizziness, losing consciousness, and vomiting are common symptoms of both illnesses. Dr. Visalani says heat-related illnesses don't have a specific target. However, there are groups of people who are more susceptible to these illnesses.
Kids, babies, elderly, or those who have chronic medical conditions who are maybe on medications like diuretics for their blood pressure, those can make you go into heat stroke a lot faster.
Dr. Visalani says drinking a Gatorade or anything with electrolytes is ideal when trying to rehydrate. And if you're going to spend the day outdoors, be sure to have a shaded area nearby, as that will help more than just drinking water. She says because frequent water intake is important during extreme heat, there is one general rule of thumb that can easily tell you whether or not you've had enough water for the day.
Just kind of monitor your urine color. So if the urine is very dark yellow, that means it's more concentrated. That means you do need to drink more water. But if it's a clear or, like a light yellow or clear, then you're adequately hydrated.
Health officials want to remind the public to limit the time they spend outdoors. However, if you must go outside, always bring water with you and always have some type of sun protective clothing on you. For more information on how to beat this year's summer heat wave, visit our website, turnto23.com. In Bakersfield, Ruby Rivera, 23 ABC News, connecting you.